a good question. We're live. It's a good
Okay.
question for
All
us to
right.
address. Okay. All right. Good morning, good afternoon, good evening,
Good morning.
depending on where you are when you're watching this live. This is the voice and the face of Dr. Tolu Olabinto, CEO and founder of Living Spring Family Medical Center here in the good city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. And today, I am honored and excited to have my friend, classmate, and awesome ophthalmologist, Dr. Kristi Kozlov, to discuss with us today. Doc, my eyes are red, but why? Okay, thank you so much, Dr. Kristi, for coming. It's an honor to
Thank you
have you
so
here.
much. It's
Mm-hmm.
an honor to be here. Thank you so much for asking me on.
Oh, my pleasure. I know you're busy, so I appreciate the time you've taken to do this. All right. So our first question is this. I already mentioned your name, but please, for those who are watching, kindly introduce yourself. Who are you, and what do you do?
So I am Dr. Kristi Kozlov. I am a board certified ophthalmologist and fellowship trained corneal specialist in the northwest suburbs of Chicago. And I help people with eyes in the northwest suburbs of Chicago and Chicagoland area maintain and or restore their vision so they can live their best lives.
I like that. You help people with eyes. that's
Absolutely.
that's that's awesome. All right. So inquiring minds want to know. And for those who are watching this live, please hashtag live. Those who are watching replay, hashtag replay. But people are wondering, why do you do what you do? What got you interested in eyes?
Yeah, so I have a couple equally true answers here. The first is a little more flowery, and the second is more practical for those pragmatists in the audience here. And the first, I'm going to start with a quote from Romeo and Juliet in Shakespeare, and that is, he that is strucken blind cannot forget the precious treasure of his eyesight lost. And so I think that this quote, and forgive the 16th century English or
Well, you're
17th,
good.
whatever it is, but I think that this quote, I chose it because it speaks to the importance of our eyesight and how integrally related it is to one's quality of life. And so I know that that plus my inner drive for a long time now towards compassion, um, I think that ophthalmology resides at the intersection of these two. And so that's the more flowery answer. As far as the pragmatic answer, probably is that somewhere in medical school, when I was looking at the different specialties and trying to decide what I was going to do with my life there, I
Mm.
liked about ophthalmology that it both offered the short, sort of sweet surgeries that one could do that gave the instant gratification of, say, removing a cataract and giving someone their vision back.
Mm.
But at the same time, it allowed me to maintain the long term relationship, patient doctor relationship, um, in the clinic with patients and their families. So that I find both of those aspects rewarding. So that's how I chose that.
Awesome. 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 Now, first question. What are the four most common causes of eye redness that you see in the clinic?
Yeah, so I was thinking about this when thinking of what I was going to say today, and because there are different, if you look up what's the most common and the prevalence, different articles will say different things depending on age group and where we're talking. So I put together what I call like the ABCDs of the most common causes of red eye. And the first A would be allergy. So allergic conjunctivitis or allergies in the eyes. And the second would be blepharitis. And what that is inflammation of the eyelids. Bleph means lid, itis means inflammation. The third, is conjunctivitis. And there are many types of conjunctivitis. The most common people think about, pink eye, is more of an infection, usually viral in adults. And the last, but absolutely not the least, one of the most common is dry eye, and that's RD. But when I'm talking about these, I'm talking more, the ABCDs are referring more to when somebody's eye just looks red to them. But obviously, I'm not talking about if they know they've had some sort of trauma, something got in their eye, they were hit in the eye, of course, the eye is going to be red. So that's another possibility. Another possibility that people might not think about actually is glaucoma. And so it needs to be considered here if your eye is red. But yeah, as far as just the most common causes that I see in the clinic on a daily basis, the ABCD covers those.
Awesome. Now I'm going to touch a little bit on eyelash extensions.
Yes.
And I had maybe one patient who that happened. Like they went in for eyelid extensions, pre-extensive lashes, no eyelash,
Yeah.
and they came back with one red eye. So
Yeah. So
what's your caution when it comes to eyelash extensions?
well, my caution is just be exceedingly careful putting anything near or on your eye. And that can be whether it's the extensions themselves, which can be contaminated if you put them down on the counter or share with anybody, or can scratch the eye if you touch the eye by mistake, or that could even be the glue on there. So here with eyelash extensions, we can see infections, trauma, just inflammation, even allergy to any of the products associated with it. So a lot of potential problems there. Better just to keep your eyes safe and not wear those, in my opinion.
But doc, they make your eyes fine.
You're beautiful. Anyway, the beauty comes from within.
Awesome. All right. So now, what are red flags when it comes to red eyes? You touched on different types, and you had mentioned that there's trauma related eye redness as well, and it the eye symptoms vary by age. But what are red flags when it comes to red eyes that people should be like, you know what? No, I really need to go see my doctor for this.
Yeah. So if your red eyes are getting worse and not going away after a day or so, that could be a big red flag. So obviously severe pain, very blurry vision, discharge, anything that would really concern you, I would definitely come in right away because it's your vision we're talking about.
Awesome. And the truth is, during wellness visits, when patients come to see me, I ask when's the last time that you seen their eye doctor, and sometimes they give me that quizzical look, like, doc, my eyes are fine. I don't see why I need to see one. I see fine, no changes, and
Yeah.
I have to emphasize,
So
like, the changes are subtle, right?
So, there are significant number of eye issues or even underlying systemic health issues that can show up in the eyes, and the patients may be completely asymptomatic. So the American Academy of Ophthalmology around the age of 40 starts recommending every 2 to 3 years, and then 60 and above usually annually an eye exam. I have seen a few people, even some people that I've done exams on when I opened my practice, just to get used to my new machines, and found issues in their eyes that had further implications for their health that nobody knew about. And now we are preventing those from becoming an issue for them.
Can you give examples? And the reason why I'm saying this is because sometimes it seems a little far fetched. Like, oh yeah,
Yes.
sure. And I do say this to patients. I say sometimes the eye changes are subtle. You don't go from I can see today to tomorrow I can't see. The changes could be subtle. But for the sake of preventive care, like what things have you caught, or what diagnoses have you um, seen based on just the eye exam?
Yeah. So um, a big one is diabetes,
Diabetes.
because and high blood pressure. People won't feel or know anything, and they go in to get, usually it's they go to their glasses to get their glasses checked, and they think they just need new glasses, and we're like, wow, you have diabetes and we need to send you to your primary care physician
Mhm.
to get that taken care of, to save both your eyesight, your kidneys, your limbs long term. So diabetes and high blood pressure are a big one. Some underlying inflammatory conditions are also super common. Glaucoma, unless the pressure is super high, people often don't know until they've lost a significant amount of vision. If you come in when you can't see because of glaucoma, it's unfortunately probably too late to bring your vision back.
Wow. Wow. All right,
Yeah,
good to note. Good to note. So for those who are watching, please share it with those your loved ones, because this is important to also note. All right, my next question is contact wearing. So we do have patients who wear contacts. You have to keep putting, the hand in the eye. What are
right.
what are tips for contact wearers to minimize the risk of, red eye or eye inflammation or
Yeah,
irritation?
so this is an awesome and very important question, because although I didn't list it in the ABCD, it should under C also be contact lens overwear. Um, so some of the big problems that people, or problematic behaviors, I guess I should say, the number one, far and away, is sleeping in contact lenses. A study from the National Institutes of Health showed that even people that sleep in the contact lenses, and we're talking the contact lenses approved by the FDA for sleeping in, less than one time per week, we're at a 4 times the increased risk of developing a vision threatening infection as a result. So do not ever, as best you can, sleep in your contact lenses. That is number one, number two, number three. Another thing that becomes a problem is when patients do not wash their hands before touching their lenses. Do not typically wear your contact lenses more than 8 hours a day. You should have an up to date backup pair of glasses so you can take them out. Um, do not use regular water, might be something that patients don't
Um,
know on their contact lenses. You need to use the contact lens solution, hydrogen peroxide based is the best, and change your contact lens case about 2 to 3 times a year. All those things can help prevent vision threatening infections. But as I said before, if you get severe pain, redness, decreased vision, discharge, even a white little spot that you see in the mirror on the front of your eye, that could be a real problem. So we need to see you as soon as possible.
Awesome. Awesome. Thank you so much. You've given a
Oh,
wealth of
my
information,
pleasure.
a wealth of information. Now, people are wondering, where can I get Dr. Kristi? Where can I go see her as my ophthalmologist? Where can people connect with you, Doc?
Yeah, so if you would like to find me online, my website is reenvisioneyecare.com, ReEnvision, eyecare.com, EYECARE. And then you can also find me on YouTube at Everything About Eyes with Dr. Kozlov. That's my YouTube channel. But I would love to see you in the clinic if you're in the Chicagoland area. I am in Buffalo Grove, so you can follow me, or I'd love to see you in person.
Awesome, awesome. So what I'm going to do at the end of this live, I will put that information also in the comment section so people can
Thank
connect with
you.
you
Awesome.
at a later date. So thank you so much again for coming. I've learned quite a few things myself, even though I'm an eyeglass wearer. I've dabbled in contacts. So
Yeah.
I know other things to do, and also other things to empower and encourage my patients to do as well.
Oh, you're awesome. She's the best.
Thank you, thank you, thank
Yeah.
you. All right, thank you for coming. That's it. And
Thank
if
you so
you,
much for having
you're
me.
welcome. You're welcome. And if you or anyone you know is looking for an awesome primary care doctor in the Mansfield area, that is thorough, that is compassionate, and that is caring, I am she. Thank you so much
Oh,
for
absolutely. See Dr. Tolu. She's the best.
coming.
She's super smart and compassionate.
Thank
So
you.
important.
Thank you. Thank you, Kristi. I appreciate that.
Oh,
Have a
take
good
care.
one, okay?
Okay, take care. Have a great weekend.
Bye.
Bye.